My lifestyle before the surgery was to be as active as I can. I'm sort of a type A personality, but a nice one. So I stay busy, always working on something, and I would go to the gym. I was 68 at the time I had this event, and I have done everything right. Exercised, never smoked, and this was totally unexpected. The night I had my heart event, I had gone to the family-wide gym and had done aerobics and weights, fine. Went home, had a nice big dinner, went to bed, fine. Around 12:30 a.m. I wake up and I'm having difficulty breathing, and I'm realizing I can't breathe if I lay down, I have to sit up. My lungs are making a huge sound, and my wife is not there, I'm alone in the house. I had to go to the ER. You know, I didn't want to go to the hospital. I didn't want to face the fact that I was in serious trouble. But if I don't go to the hospital, I'm a dead man. What happened to me was I had a congenital mitral valve that had a slight leakage, but gradually it got worse, and finally, on August 8th, 2017, it failed. The valve was leaking slowly worse and worse over the years, and it was making me tired, and I just attributed it to be getting older. The ER director there came in and said to me, "Jonathan, you're in congestive heart failure." I was shocked. This fellow who exercises, and I was like, you know, lifting weights seriously that day, and congestive heart failure, I was like, I can't believe it. And so he said, and this was the wonderful thing, he said, "But you can be fixed." And he explained, he said, they have to go in and repair or replace the valve, and you'll be normal again. We get to Rex Hospital, and my first appointment to meet Dr. Anderson is at 2 o'clock. So we stop at Panera's and have lunch, and it's full of hospital staff in there, lots of young people, lots of medical professional people. And here I am, I'm a doctor, but I'm a retired psychologist, and I felt so small, so insignificant. I thought, how would these people want to save me? But when I got there, Dr. Anderson's staff, Dr. Anderson, they just made me feel important and valuable, and it was wonderful. I would look at the echocardiogram when they would do them and see it on the screen and ask questions and so on, and I'd see my valve, and one of them was flopping all around and it looked like toast. And I said, there's no way he's going to fix that valve. But he went in and he fixed it.
He had congestive heart failure. His situation was actually very complex. To repair his valve, we had to remove calcium from the perimeter of the valve, and we also had to resect or remove part of the posterior leaflet, that part of his valve that was flipping up in the air. We had to take a portion of that out and resupport it with some artificial cords to replace the cords that were broken. And then the final part of his repair was to put in an annuloplasty ring that you sew in to maintain the normal geometry of the valve so it doesn't enlarge over time, and helps maintain the integrity of the repair.
I came out of the surgery and I found out not only did he not replace the valve, but he fixed it. I was like gleeful. I was telling jokes. I was like, I've heard about people after heart surgery that they're depressed. This boy is not going to be depressed. I'm fixed. It's a miracle what they can do in medicine today.
When you have bad leakiness of the mitral valve or mitral regurgitation, it causes congestive heart failure, and it will shorten your life and it'll impair the quality of your life because you can't breathe, you can't stay active, you can't do the things that you want to do. If you intervene on that valve early enough and repair it, they can live a normal life. It's like they never even had the disease. You're actually curing them. And you can't say that for every disease.
Now, after the surgery, I feel like I'm 21 again. So it's miraculous now that I'm fixed, how much better I feel. My wife's always telling me, you need to take a nap, because I can work all day, I can lift weights, I can do hard things, and I don't get tired.
You encounter people that are in a very vulnerable, scary position with a life-threatening problem, and you can do something to change that and save their life, improve their life, and give them a second chance. And it's great to be a part of that.
I have a new idea about getting older, and I sincerely believe that now I can go into the 90s because everything, and I do everything right, is just working so well. So I'm going to have a lot more fun. My wife and I will take more vacations and do things like that. I just have a very positive attitude now about older age, where I used to think that I was slowly going down. Now I feel wonderful.